Hello everyone, this is Shilayano,
And my name is Adrian Oyo from Maseno University.
and we are going to answer the question. Imagine you talk to members of the European Union about the cultural aspects of mental health in Kenya. Prepare a brief speech in which you reflect the insights from your individual research and group discussions. You should address the topic of stigma, mental health prevention, mental health diagnosis and treatment, and mental health financing and advocacy.
So I'm going to start with the mental health stigma. So Kenyans living with mental disorders often experience stigma on multiple levels. Stereotypes surrounding those with mental illnesses lead to public stigma, especially since many people associate mental illnesses with evil. Furthermore, those struggling with mental disorders may internalize others' negative perceptions of them, impacting how they view themselves and their overall quality of life, since it can lead to loneliness and isolation. Stigma is a factor preventing Kenyans from receiving efficient treatment. Therefore, greater public education on mental disorders and providing more resources for mental treatment can improve the lives of those living with mental disorders in Kenya. A better understanding of mental health in Kenya will aid in destigmatizing of mental disorders, leading to effective treatment. So the next point is on mental health diagnosis. So to determine a diagnosis and check for related complications you may have, there are three different diagnoses steps that a doctor or an individual goes through. So the first one is a physical exam. So your doctor will try to rule out any physical problems that could cause your symptoms. So the second one is lab tests. So these may include, for example, a check of your thyroid function or a screening for alcohol and drugs. And then the third one is a psychological evaluation. So a doctor or mental health professional talks to you about your symptoms, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. Sometimes it's difficult to find out which mental illness may be causing your symptoms, but taking the time and effort to get an accurate diagnosis will help determine the appropriate treatment. The more information you have, the more you'll be prepared to work with your mental health professional in understanding what your symptoms represent. The defining symptoms of each mental illness can be detailed in the Diagnostic and Statistical Manual of Mental Disorder, popularly known as DSM-5. This manual is used by mental health professionals to diagnose mental conditions and by insurance companies to reimburse for treatments. So the next point that I'm going to discuss is on mental health prevention. So to prevent mental health complications or illnesses, then the government needs to invest adequately on mass education. So educating the people about mental health will in turn make them aware, or rather know how and what to do in case of an emergency. So mental mass education also helps in eradicating stigma, and when stigma is eradicated, mental health patients will live a life free of judgments from others. Yeah, so I'm going to hand it over to my colleague to continue with the discussion.
So I'm going to talk about mental health treatment, mental health financing, and mental health advocacy, and we'll start with mental health treatment. In Kenya, mental health treatment is done in psychiatric facilities, and currently Kenya has 10 psychiatric facilities, and there are different treatment options that are done in Kenya, and they include the following. First, we have psychotherapy, and this is the therapeutic treatment of mental health illness provided by a trained medical health practitioner, and it explores thoughts, feelings, behaviors, and seeks to improve on an individual's well-being. And psychotherapy is often combined with medication so as to ensure that it is successful. The second method is medication, and medication helps with the management of symptoms that comes with mental illness, such as aggression. And we have case management. Case management coordinates services for an individual with the help of a case manager, and a case manager helps to assess, plan, and implement a number of strategies to facilitate the recovery of the patient. The fourth method, we have hospitalization, and sometimes an individual can be hospitalized in order to closely monitor, accurately diagnose, or have medications adjusted when his or her symptoms worsen. We also have the self-help plan, and this is a unique health plan where an individual addresses his or her condition by implementing strategies that promote wellness, recovery, triggers, or warning signs. Next is mental health financing, and the funding for mental health in Kenya is very low despite the growth of people with mental health issues in the recent past. Mental health is not a priority agenda for both the national government and the county governments in Kenya. But however, the country has made major strides in addressing mental health issues, and more political leaders are now championing for mental health to be made a priority. More funds have been added for mental health, and we have the Universal Health Coverage and the National Health Insurance Fund, which covers for patients with mental illness, and it covers for both outpatient and inpatient services, and more patients with mental illness are able to get treatment using the NHIF and the Universal Health Care Fund. And more funding has led to the development of more psychiatric hospitals. And for example, in the recent past, President Kenyatta led the launch of building the Kenya International Mental Health Wellness Hospital in Kajiado, which will see more patients getting treatment for mental health. And lastly, we are going to talk about mental health advocacy. And there has been an increase in the advocacy of mental health in Kenya. And in Kenya, we have the Mental Health Act, which is the main piece of legislation that covers the assessment, treatment, and rights of people with mental health disorders. And this ensures that people with mental health issues are able to get respected and their rights approved. Thank you.
So despite the fact that the Kenyan government is trying to improve mental health, more still needs to be done. So for instance, we still need to get more funds being channeled to mental health and mental health issues, and more facilities needs to be built so that we can have patients having a variety of hospitals to choose from. So this will in turn help in decongesting the 10 facilities that are currently available in Kenya. Yeah, so that is all for our presentations. Thank you very much.
Thank you and goodbye.